service to health. So I know that's what y'all been learning, y'all been studying, so we're gonna touch on that soon. But before we get into that, I had something on plans to say, but after listening to y'all, I'm like, I wanna live in a world that y'all create. Y'all are creating a world that is gonna make a better place for moms and babies. This is so important because first and foremost, we all come from a mother or some form of a birthing person, and then as well as that, we all have their children. So it's our responsibility to do these things. In a world that y'all creating, I already know it's gonna be a better place. So with that being said, we're gonna be talking about how we can rethink health beyond just medicine. Because a lot of times when we are thinking about how can we change maternal child health outcomes, we're thinking about the doctor, we're thinking about what type of care is being provided, but it's deeper than just medicine. It's deeper than just going to a doctor's appointment and getting a prescription or a pill or something of that nature. So what we're gonna be focusing on is how can we address the causes of the cause. My name is Ms. Abdul-Hameed. I am a women's health equity researcher. And basically what that means is I spend my time figuring out how can we make sure that Black women's health are having positive outcomes and they are not dying at higher rates than any other races. So with this, I had the blessing to be able to travel across the country, present my research, different presentations, and tell people what changes we need to make this possible. As well as that, I am a doula and a perinatal patient navigator, which is why I started my business, Lamis Womb Care. And with that, what we do is provide mothers and babies and families support from the time of preconception, when they are first thinking about conceiving, throughout the time of pregnancy, childbirth, and then as well as postpartum. So we don't just focus on getting them ready for the pregnancy or just having a baby, but we're tackling things holistically like you all did in your villages. We're doing maternal health care, we're doing nutrition, we're making sure that they understand what does it mean when you go to a doctor's appointment. If a doctor tells you that you have preeclampsia, what does that mean? We break it down into steps like that. So I came down to Georgia to get my master's of public health. So I'm proud to say that I am a graduate of Morehouse School of Medicine. And so that is a little bit about myself. The city that I am from is the capital of New York. So growing up in New York, it made me see for myself in the community that I'm in, how Black women, especially when it comes to maternal and child health, they were dying at higher rates. They were not getting the care that they needed. The resources were just not there. So growing up in that community, I thought it was normal because if you see something on a day-to-day basis and you don't know anything else, it seems normal to you. But then once I got into the field of maternal and child health research, seeing the actual statistics and the data, I was like, no, we gotta do something about it. So in the capital of New York, Black women are dying at a rate 5 times higher than white women. Black women make up 14% of live births, but they make up 32% of maternal and child health deaths. So that is showing you a very big disparity. What made me very frustrated is finding out that 74% of these deaths are preventable. So we can do something to stop these women from dying. And not just our mothers being affected, but babies as well. So Black babies are dying at a rate 2 times higher than white babies. So I want y'all to grasp that for a second, okay? Those numbers, I want y'all to keep in your mind, and I want y'all to really think, because based off of your village, I know that y'all are forward thinkers. So I want y'all to be creative, and we're gonna figure out how can we solve this issue, and what will you all do to bring your uniqueness to make a solution? Because each of you in this room, y'all been placed on this earth for a unique purpose, whatever that is. Yes, we all have a passion to change maternal and child health, but we're not gonna do it in the same way. And that's good. We need to do it in our own unique ways because what you came on this earth to fulfill and do, only you can do. I want somebody to tell me, what are the social determinants of health? Can somebody give me those answers? And then I'm gonna put them on the board. All right, education. Definitely. Neighborhood and built environment. I'm gonna put environment, income.
Health and healthcare.
Yes. I'm gonna put access to quality healthcare. Red, pink, and then black.
Health and social and community.
And sorry, I'm saying y'all shirt colors. I don't know y'all names yet. Okay, pink,
Oh, I was just gonna say social.
same thing? Okay, how many we got? 1, 2, 3, 4, 5. 3 more. Does anybody know? If y'all don't know, it's okay. I'll put it up on the board. Okay, so we also want to look at safety and violence.
Yes. Well, maybe that falls into social and community, but I was going to stress.
That's perfect. As well as that, housing and transportation. So you have to have safe and quality housing, and you need to have transportation. So can you get to your doctor's appointments? Can you get to community resources that can improve your health? And then policy. Okay. So based off of what you guys are seeing, these are any of the things that can be a problem in the capital of New York. I want y'all to look at something. I compared the state and the city, and I want y'all to look at these numbers. When we are looking at how many people do not have jobs, how many people are currently in poverty, how many people are on food stamps or receiving public income, the number for the city is significantly higher than the number for the state. So that is showing that there are disparities that we need to focus on and address. I want y'all to tell me something. And we're seeing that most of the population does have health insurance because only 6.2 do not have health insurance and close to 40% have Medicaid. That shows that most people have insurance. So if we're looking at the social determinants of health and we're trying to address these things, which one is currently being addressed already? Access to healthcare. So we're gonna put this as number 8. And the reason why we're putting that down on the ranking is because it's currently being addressed. We gotta figure out what's not being addressed and how can we solve this. So taking a look at this one here, this is breaking it down by race. So comparing Blacks and whites. We see in the capital of New York, the population is mostly white. It's close to 70%. Black people make up 13% of the population. But what I want y'all to pay attention to next is how much each household is making. White people are bringing in close to 90,000 per year. Black people are bringing in 44. So that is almost half of that number. So we're seeing a disparity in what already? Okay. All right, good. So let's put this as number 1 for right now, since that's the biggest disparity that we're seeing. 11% of Black people do not have a job in the capital of New York. And then as well as that, we know the health insurance, but that is a very low percentage. When it comes to people that graduate with a bachelor's degree, 47% of white people have graduated with a bachelor's, but only 22% of Black people did. So now that we're seeing education, let's give this number 3. So we're seeing that one of the social determinants of health is housing. And then the problem is that currently 70% of people that own homes in the capital of New York are white people. 20% are Black households. So this is showing that many mothers do not have accessibility to quality housing, safe housing, and affordable housing. This is a really huge problem. You cannot carry a baby to full term, be healthy, avoid pregnancy complications if you have the stress of housing. And then if I recall back to myself being a college student, if I didn't know what was happening with my dorm where I couldn't pay for my room and my board, I can't focus on school. So imagine being a mother trying to take care of your children and your babies, but you do not know if you have quality and safe housing. Food insecurity, we're seeing in this capital, 36,000 people are facing food insecurity. This is a problem because the population is only 100,000 people in that capital of New York. So a lot of people do not have accessibility to healthy food, safe and quality food. And then a lot of times growing up in that type of environment, it's a food desert. So you're going to the store, shopping for your kids, but you're going to a corner store. You're going to like a bodega. You're going to a Family Dollar. And what's the problem with shopping for food at those places? That's correct. So we're gonna go ahead and put this at number 2 for right now. Now, when it comes to the environment, we're seeing that there is a large toxic burden. When we look at these numbers, the closer you get to 1 shows that the toxic burden is higher. Now, the problem is that for Black people, their toxic burden is at a number 2. For whites, it's 0.4. The major problem with this is that it is on-site releases of toxins. So that means there is toxins in the air, toxins in the soil where people are getting their foods from, there's lead in the wall, and this number is showing that there's a very big disparity. So we're seeing now that environment is also an issue. I'm gonna put a number 4, but somebody tell me, based off of what we're seeing and how we are comparing the different problems in the disparity rates, how would you rank the environment? Would you move that up or keep it at a 4?
Go ahead for that.
What number would you switch it with?
Honestly, I would think it.
Make it 1? Somebody said 2? And why do you think 2 instead of 1?
Because I think that 2 instead of 1, because you can still survive in those areas to a certain extent, but with income, imagine being homeless or being without any income on top of having these toxic environments. So it's like adding on to the disparity of low income.
Okay, what do you think about that?
I would say 1 for environment, just because your environment can impact your health in so many ways. So like, let's say you are living in this area and you're sick, can't go into work, so therefore your income will be impacted because your health is impacted. And then also when it comes to income, let's say you are homeless, but you may be homeless in an area that's not badly impacted by the environment. So I would say like the environment just does so much. It's in your food, it's what you're eating, it's in your housing. So it's just a lot that goes into it.
What you think about it?
If I had to choose, I would put income at 1 only because that is an immediate issue. Like, obviously, like having toxins and stuff is very, very important because it can affect your health, but it does happen over time. It's not like the first day you're in there, you're immediately need to be hospitalized, like right at this moment. But like income, you can only last like a certain amount of time before you actually cannot survive.
Oh, I was just gonna say, kind of adding on to that, the income that's needed for the hospitalization of that is also, you can get untreated and then continually, but then that also kind of goes to environment too, so.
Okay, so y'all currently are working to improve maternal and child health. So what consensus are y'all coming to?
Both of them need to be done.
That's true.
They're both tied practically.
Okay, so should we do, let's put 1/2 for now, okay? And as we keep going, we'll figure it out, okay? Okay, so then just continuing with giving out more facts. In 2020, the capital of New York was rated one of the worst cities in the country for discrimination, for stress, and racism. What are we going to rank social and community now? Because it's not 2 no more, because we did that for environment and the income.
Then make education. Wait,
3.
no, 3. Wait,
What y'all ranking?
4.
I would say 3.
Y'all gotta come to a consensus.
I think 3.
3? We going with 3, y'all?
It's because like if you go to the hospital and you're not really getting adequate treatment, like that could be very detrimental for your baby. And that's a lot of the reason why a lot of women like have to keep going back and forth to the hospital because they're not being, I guess, monitored the way that they're supposed to.
I'll also agree with her, because, once the discrimination, stress, and racism comes in, like you said, when you focus on one thing, something else declines. So I think, who you surround yourself around, who you are surrounded by, it lacks whatever you'll learn or, gain from others, so you may not get, a proper education or.
Okay, I like that. What about you?
I would think of it differently about education, but more the education of educating the providers as well, making sure that providers are educated. That would directly affect the discrimination and racism, which would then into terms like the social and community stress.
So in 2020, it was ranked one of the worst cities for pay. And we see that with the income being number 1. And then in 2021, researchers found that 45% of residents do not have a car or reliable transportation. So what are we putting this number as?
Kind of is because housing is with it.
That's correct.
I don't know, I just like, I'm having a hard time ranking them all because one ranking impacts another regardless of what.
But y'all have seen the chart, right? It's a revolving door. So y'all all are correct. And don't forget, just because we're gonna rank them, don't mean one is more important or less important. It's just which one we're going to tackle and correct. But y'all gonna see in a second. So what number do y'all want to put? 5. Lastly, in 2024, Researchers found that Black women make up 50% of the adult arrests in the capital of New York. So this is showing us when it comes to safety and violence, because we do know there is discrimination and racism. And just because someone is being arrested, don't mean they did something wrong. And then as well as that, when it comes to maternal deaths, this can be once they are incarcerated, are they receiving proper health care? And then how is the stress when they are incarcerated? If housing and transportation is 5, what should we be ranking this one as? Now, we're gonna start to work through these. So currently, this is what is being done to make some changes. So right now, we are seeing the increase of community doulas. There is doula training, and thanks to BirthNet, they are training a lot of women to make sure that pregnant women, postpartum, they have that support that they need. We're seeing policies being put into place, so they're trying to ensure that doulas are covered under the insurance. We're seeing interventions being adopted because of these policies. So whether that is like a food as medicine program, teaching moms how to cook and have healthy food, we're seeing those being adopted. As well as that, policies are improving accessibility to care. And then we know nothing happens without money. So policies are influencing funding. So based off of what we're seeing happen, which ones can we cross off that's being addressed already? Social and community are doing a great job. Okay, so we also see nurses pushing for quality care. If y'all know any nurses, have family members who are nurses, a lot of times they can work 12-hour shifts. And me being a doula, when I'm in the hospital, a lot of times I see that nurses are telling moms there's not enough pillows, there's not enough room. So a lot of nurses are being burnt out because of the lack of support. So we're seeing them in the capital of New York pushing for different policies. There has been something that has been passed to make sure that there's mandated reporters. So if there is abuse going on, they have to report that. And this protects the maternal and child health population. We're seeing direct financial support for community health services. They just passed this program where they are giving moms $1,000 per month for their first 12 months of pregnancy and postpartum. They do have to meet the poverty level line, but that still is very helpful. So what can we cross off now based off of what is happening?
Comments, safety and violence.
Safety and violence, can we write
Safety and violence yet? Since we have a mandated report.
I would say that will go more with healthcare. What do y'all think though? Yeah? Do you think so as well?
Yeah.
Okay, perfect. So I want y'all to look at these beautiful, amazing Black women. And I want y'all to see that there are so many different ways that you can make a change in maternal and child health. Remember when I told y'all that y'all have been placed on this earth for a very unique purpose. Y'all can fulfill it only in a way that you can fulfill it. Of course, we can look up to people and see how they did it, get inspired, but you have your unique way of doing it. Whether that is through tech, policy, being a midwife, doula care, being a scientist and a researcher, going into the business world and being in the C-suite, or going into medicine. So y'all just have to figure out what is the way that you will make a change to this care. I want y'all to divide yourself. Can y'all do that into groups? We got 1, 2, 3, 4 left, so I need 4 groups. And then I want y'all to be creative. How will you add to the solution for the capital of New York? So we know the ones that we took out is already being addressed. These are the ones that are left over. Education, environment, safety and violence, housing and transportation. So what will your group come up with? Will y'all create a new system of care? Will y'all make different policy changes, ensuring that there is accessibility to housing, creating different policies to give people funding who were shut out due to redlining? Will y'all create different interventions? So that can look like doing something like a doula training where they're teaching moms about prenatal care, postpartum care, lactation consulting. Will y'all create community support, like a breastfeeding group? Moms who want to breastfeed can meet moms that are currently breastfeeding or planning to breastfeed. A postpartum group, moms that just had their babies can connect and talk about their experiences. Will y'all create tech tools? Is there going to be an app that's going to be able to see the environmental pollution and tell moms which places are safe for them to go? Or will y'all do it through teaching knowledge about how to prevent safety and violence and how to respond when you're inside of those situations? And I want y'all to be super creative. I want y'all to tell me what y'all came up with. Be creative. Think outside of the box. Let's start off with safety and violence. What's safety and violence? All right, can y'all tell me what y'all came up with to add to the solution for the capital of New York?
Yeah, we had 3 like different things that we came up with. The first thing I mentioned was an app that I came up with the previous class for an entrepreneurship class, where we essentially made an app that was trying to defeat the school to prison pipeline. And so it was based in Atlanta, but I think you could also bring it to New York where students from HBCUs are mentors, and it allows for there to be visited shadow days with students so they can see what's outside of whatever their environment is, and just like having an accessible way to have different programs towards that.
Domestic violence, specifically if you're like, you have children or if you're going to give birth and you're in those kind of situations, probably like having a group. We also, that you can sit down with, or like a remote collective that you can sit down with saying, you know, these are the problems I'm going through, and trying to find ways, because it could be hard with the family and those people are very familiar with the person that is abusing you, trying to get away. So it would be nice to like have the support system there. And also, we also brought up the safe houses for like people who are going through like domestic violence, who are mothers and who are birthing people. Just people who like volunteer, organizations that volunteer to support and protect those women going through stuff.
I love that. So tell me if I'm right, it sounds like y'all did tech, community support. All right, that's perfect. All right, let's do environment.
So we had a couple different ideas. So the first one was a mutual aid center she came up with that provided like masks and water to stop the pollution, or like to protect yourself from the pollution, like not having clean water in New York. The second thing was an app where that showed like power plant locations. The third one I came up with more funding the sanitation to get rid of waste properly, because there's a lot of littering. And this kind of goes in hand with the fourth one, which was like waste control, and like how like a lot of businesses that like particularly food businesses will like throw away a lot of their food at the end of the day because they just don't have anywhere to put it in. They make things fresh. So instead of throwing away that food, I was thinking of like how firehouses have like safe haven boxes where mothers can drop off their babies if they're not able to take care of it. But like instead of it being for that, it will be a bigger version of a safe haven box where mothers can come and pick up the food from the restaurant before they close, just to prevent waste control, but then to also help with giving the nutrients that the mother and the baby need. Yeah, that was it.
Okay, so what did y'all pull from? I heard tech tools, what else?
Tech tools, I would say community support.
I would also say like science and research, because with the app, you would need to like conduct research on where like specific places that are like super toxic, or a lot of the areas.
Okay, and y'all had a third one, right? Y'all said tech, science and research.
Community support.
Community support, perfect. All right, that's amazing. Y'all are just great. All right, let's do education, and then we'll close out with housing and transportation.
Okay, so we kind of tried to figure out where exactly the education is lacking, but it's lacking in both the doctors and patient education. So incorporating some type of bedside manner kind of class in med school, or whatever kind of training that you're going through, just to kind of understand and really like try to get information from a patient. And then the next step would be like creating some type of guided journal for patients to be able to jot down just stuff that they're going through. So when they do go to their appointments, they're able to give a holistic review of the stuff that they've been experiencing, so that the doctor can like better analyze, I guess, whatever condition that they're going through.
I love that. So what I heard was creating new systems of care. Is there anything else?
Maybe intervention. Oh, and like, so the journals come with like a pamphlet with whatever condition they're going through, just to have.
That's perfect. All right, and then let's close out with housing and transportation.
So for our group, we have some from tech and something that's more policy. So tech wise, we wanted to do kind of like an app like Uber or Lyft, but specifically for mothers, where the cars already have car seats available based on whatever information you put on there. So they can get access to whatever appointments or wherever they need to go. It'll be specifically for women and children. And then in terms of policy changes, we were talking about like government housing that could potentially open the possibility for people to rent to own. Because we were talking about the credit disparities that exist in Albany and just helping them build their credit, not, making policies that would prevent predatory loans and things of the sort. I don't know if anybody else. Yeah, that was mostly it. And then also making sure like landlords, there's a policy to ensure that landlords are upkeeping the property to make sure that if there's like mold or lead or whatever the case may be, anything that causes illness, that they're on top of that, making sure renovations are made.
I love that. So that sounds like policy and tech tools, is that correct? Everything I came up with is fire. I love it. I hope that this was very helpful for y'all. I hope this got y'all minds thinking. I'm excited to live in a world that y'all created. So, I'm gonna keep myself healthy so I can live. What y'all are doing right now, y'all are setting the standard. Y'all are Spelman College. So y'all are setting the standard. Y'all gonna address the cause of the causes. Remember, health is more than just healthcare. This is everything that y'all talked about. But then as well as that, who is responsible? So we know policymakers are responsible, healthcare leaders, community boards, but you're responsible. Like I said, we all came from a mother or a birthing person, and we all were a child at some point in time. And then we have children we care about, we have parents we care about. So it's up to us to make the change. What can you do? Exactly what y'all are doing now. Getting these degrees, becoming smart women and leaders that are gonna make a change. Like I said, standing your unique purpose, because what y'all came up with, it doesn't exist right now. But it took y'all unique way of thinking to come up with those things. So we need that inside of this field. So me and your amazing professor want to bring something great to y'all. Y'all getting first dibs on this because we haven't told nobody. And once we do, it's gonna fill up fast. And take out the time to do this because what we're gonna be doing is workshops based off of things that are happening in real time. They're gonna be solving problems that are happening right now, kind of like we did today. And then as well as that, by the time you complete the certification in May, you will be able to go out into this world and serve as a perinatal patient navigator. So you'll be certified. We're gonna make sure that you guys are able to network with leaders inside of the field. So in those fields that we talked about, tech, policy, healthcare, whatever the case may be, we're gonna make sure that y'all get to speak to those people, shake hands, and make those connections. It's gonna position you to be a strong candidate for graduate school programs and your career. No matter what field y'all go into, you're gonna need to know these things so that you can provide the change that we need to see. Because y'all so amazing, if y'all need anything from me, feel free to reach out to me. Whether you need mentorship, you got questions, whatever the case may be, I'm here to support you in whatever way that I possibly can.
For the reflection for your guest speaker, we got two options. One option is to write a one-page paper on what you learned today and then turn that in. Or the second option is to do a discussion post. So I'll give y'all some prompts for both. So you can do a discussion post and then reply to two classmates.
Nice to meet you guys. Thank you so much for being amazing. Nice to meet you, Zara. Okay, I hope to see you soon.
Wait, can you
Okay, have a good one. Nice to meet you.
Yeah, you're on campus. Yep, I see a lot of stuff.
Make sure that you send me a text or something.
Okay.
Okay,
thank you so much.
Have a good one. Nice to meet you. Say your name for me again. Nice to meet you. Nice to meet you. What's your name?
Yes.
Nice to meet you. Thank you so much.
You're good.
I would be a nurse after.
I know that's right.